Hi, my name is Julie Wilkinson. I am a research scientist and I work in the healthcare industry. I have for almost 30 years. And what that means is I am part of the group of people that research, develop products for our healthcare providers to make the world a better place. And I've been lucky enough to be part of countless products that are out there still in the world every day impacting millions of lives. And as such, I've been involved with the diagnostics parts of things, the therapeutics, the drugs, vaccines, understanding patients, doctors, nurses, lab technicians, and working with the FDA along the way, a lot of it, in order to make sure that we have safe and effective products. So this video is the fifth one that I've done, and I'm calling them Simply Said Science. And it kind of arose because friends and families were asking me questions with all the information that we've been getting on TV about the coronavirus, the pandemic, and COVID-19, and what does it all mean. And I realized that there's a lot of jargon out there, and there's a lot of stuff people talk about, and they're trying to be clear, and it's still not always clear. So I really hope the Simply Said Science series is helpful to you, to allow you to understand what's coming at you so that you can make your own decisions for what works best for you and your health and your family. Okay, so in a previous one, we talked about the 3 magic bullets for killing and fighting a disease. And those magic bullets have to be able to find the problem, fix the problem, and then prevent it from happening again. So these 3 are diagnostics to find the problem, therapeutics and drugs to fix the problem and treat it, and then preventatives such as vaccines so that it won't happen again. So those are the 3 magic bullets. Today we're really going to talk about the diagnostics piece of it because that's what's in the news a lot right now. So what's going on with the diagnostics? So if we think about diagnostics, let me give you a scenario. Your car starts making funny sounds, and so you take it to a mechanic. That mechanic is now going to diagnose what is the potential causes or root causes of the problems that you're seeing with your car. So what do? They listen to the car, they take it for a test drive, they may have to do some deeper dive, hook it up to a fancy computer, and then the technician will take all of that information, put it together, and come up with a diagnosis and say, this is the problem with your car, and here's the bill for what it's going to cost to fix it. Okay, that's a diagnosis. Well, in healthcare with humans, we're a little more complicated than even the fanciest car, even though the car manufacturers don't want us to think that, but we are. So the human body is much more complicated. But the process is the same. You don't feel well, you have symptoms. You go to your doctor, your healthcare provider, they will listen to what your symptoms are, then they will start looking at a bunch of things that they would want to look at. Do you have a fever? Are you dizzy? All of these kinds of things. Those are all, they're doing a diagnosis. They want to get to the crux of the problem. Well, many of the times they have to use a diagnostic tool, so a diagnostic. And what that does is it allows them to test something, get a result, get an information, and then the doctor will pull all of those pieces of information together so that you get the whole picture of what's going on and really come up with a diagnosis of what the root cause of the problem is, so that then once you have a diagnosis, then you know how to treat it and how to move forward with it. So that's a diagnostic is just a tool that is part of the arsenal that doctors and healthcare providers will use to make decisions about how to treat you. Okay, so with going on right now with the pandemic, when the coronavirus, the new SARS-CoV-2 appeared, it was new. It's never been in humans before. So that means we didn't have any diagnostic tools that were designed to be able to find it or even measure it. There's nothing out there. There still is nothing out there that is FDA approved. what has happened is the FDA has, and with the Health and Human Services, have come up with this Emergency Use Authorization, EUA. And what that is allowing is for manufacturers of diagnostic tools to be able to come up with a small amount of information, guaranteeing that the product will perform, and they submit a small package of information to the FDA, and then the FDA will look at it and make sure that it is going to be able to do what it says it will be able to do. Now, if this was a full-blown product, there would be a lot more things that the product could claim that it does. But these are emergency use. We only had a short time to be able to do it. And the reason this happened was because the FDA said, look, this SARS-CoV-2, it's going to cause, it's causing illness, and it could be life-threatening disease. So they look at the package of information that's coming in from the manufacturers on these diagnostic tests, and they say, look, based on all the evidence that we have available to us right now, it is reasonable to believe that this product may be effective in diagnosing COVID-19. There's a lot of hedge words in there, but you have to, because it's not black and white. We don't have all the answers for them, but it is something. And they're saying, look, the potential benefit of having this out there as an emergency use product is that we will be getting information. It will be able to help, and it outweighs the risk of not having anything out there. So, in other words, in a pinch, we're going to get some information. It's going to help many different things. So, why the rush? Well, we need the information that diagnostics provide, and we need this to be able to help various groups make informed decisions, to really understand what's really happening instead of trying to guess or assume or use a model that may or may not be based on something exactly the same. But a diagnostic, it will give you a result that then you can kind of make more informed decisions, such as treating the sick. We're doing research on this disease. How do you do research if you don't know where it is or what it looks like? For public health decisions, how are we going to reopen? What do we need to have in place? Can we use a diagnostic test as part of tracing? And also, as we're looking at new treatments and therapies, well, how do you know if it's working? Do you have to wait for the patient to either walk out the door or not walk out the door to know if it worked? Well, if you have diagnostics, you can kind of measure your progress along the way. So there's a lot of different applications of diagnostics, and that's why there was a real rush to be able to get something out there so that we can start evaluating it. So just keep in mind that, let's see, right now I think there's almost 50 diagnostic tests that have been approved under this emergency use authorization for the U.S. That's 50 different tests, and not all of them are exactly the same. They're not exactly the same. They can't be. So each one is giving slightly different answers, but the overall goal of them is to be able to say, is it likely that you have or had COVID-19? This is the whole purpose of them. The specifics and the details, that's going to have to sort out when we start gathering all that data and saying, oh, well, these 5 tests gave us, a broader answer than these other 10 tests. They didn't give us as broad an answer, so we may not be able to use that going forward for when we go through a full approval of a diagnostic. So we have these emergency use ones. They're not perfect, but they are something, and they are giving us valuable information and data. So what kinds do we have? There are 2 kinds. One is a molecular based, which is looking at the virus itself. So looking for the RNA that is inside the virus particles coming out of a sample that came from a human. And they're looking at like respiratory type samples, either a nasal swab or a throat swab or upper airways. And so they're looking for the virus there. So it's looking at it inside. And the molecular tests, these were the first ones to come out, and it's what we have the most of right now. There's like 43 or 44 of those already approved for emergency use. And what the FDA is saying that means, it's saying if you get a positive result from these molecular assays, then it is very likely that you have COVID-19. And that's what they're saying, very likely. Okay, because we don't know much else yet. If it's negative, but your physician really does believe, hey, there's a lot of other things, then they can still declare it as COVID-19 because the tests are not perfect. So remember that it's never a single test. A physician never uses a single test as an answer. It's always multiple that they put together to weave up the whole picture to be able to make your healthcare decisions. What we don't know yet about what if a molecular test comes back positive, does that mean you're going to develop a symptom? Say you don't have any right now. Does it mean you're going to develop the disease? Don't know. Maybe yes, maybe no. Does it mean you're going to be infectious to others? Yes, that's for sure. But for how long? Don't know that yet, right? We're still learning about this disease and how it goes. And your immune system may be able to handle it just fine without you ever actually getting sick, but you still may be infectious. So that's the molecular test to say, is the virus, has it made it into you somehow? And that's all these tests are saying, yes or no. And then it's up to the physicians to kind of put it together. The second kind, in addition to the molecular, is what you may be hearing about called antibody diagnostics or serological diagnostics. So they're called serological because they test your serum, which is part of your blood. And so these are blood-based tests that are looking for antibodies that your body has made in response to the SARS-CoV-2 virus and to the COVID-19 disease. So it's just looking for, in your blood, do you have these antibodies present or not? And what the FDA says that means, if it comes back positive, you may have current or prior COVID-19 infection. May. That's all that we're claiming right now with these emergency use diagnostics. So what don't we know yet? Well, if you're positive for the antibodies, okay, what does that mean? Does that mean you'll never get it again? Don't know. We don't know what that means yet. Because we don't know about this disease and what controls it yet. If you're negative, does that mean you were never COVID-19 positive disease? No, that's not what that means either. At this point, they are finding people who have had the disease that are not testing positive for the antibodies. That either means the tests themselves are not seeing the right antibodies or looking for the right antibody, or you were able to deal with it and your immune system never really generated an antibody against it. There are other ways to be able to fight viruses without generating an antibody. So again, we're learning about the disease. We don't know what all these things mean to us yet, but we do know we can see the virus and we can see if you did mount an immune response to it. What those mean, don't know yet. So those are the two coronavirus specific things that are happening. So not only is it important for you to understand, so if you're getting tested because your physician feels like you need to be, they will work through what these answers mean with you, what a positive means, what a negative. It could be, the answers could be a false. You may not, it's not 100%. So remember, nothing is done in isolation. These tests work with all the other symptoms and all the other things that are being looked at by physicians and healthcare providers. The other thing is we're looking at using these for disease research, being able to understand, okay, how long have you had this virus present in your system? Were you infectious? If we come up with new drugs, what are we doing? So the diagnostics these same ones are being able to be used in that. So some of the issues, I guess, really is we don't know a lot about the disease yet. It seems like it's been months. Well, that's not very long, but we are learning more every day. And the false negatives, false positives, each test has their own percentage that those may happen. So it varies test to test. The reproducibility of a lot of these tests is not great, so it may not be the same if you did it 5 times in a row. And the reliability, they may not always work. So all of the healthcare workers, epidemiologists, everybody, we understand this. We know that these are going to happen, and we're working with that, right? We'll learn about what they're telling us. In the meantime, there are still other symptoms that people are looking at. Your healthcare provider is not going to just make a blanket decision based on a single test. So you don't have to worry about, oh, it's not perfect. No, it's something, and it's helping inform decisions. And so that's really where we are with our diagnostics right now. They're getting more, they're getting better, and we are learning a lot based on it. So I hope this helps to understand more what diagnostics are. We have the molecular and the antibody-based, and what they're telling us and what they're not telling us, what these tests, what are the results really telling us right now, and what can we do. So just please stay informed. The really good sources of information are the CDC, the WHO, and your local public health. These are wonderful resources of the information that's coming out, and they really are doing, I think, a good job of really trying to put it in like real people terms so that all of us can understand and be able to do things. Be careful of misinformation. There's a lot of that as well. They're calling it the infodemic. So arm yourself with the facts and relax. We will get through this. We're all in this together, and we will get through it together.